So you're interested in providing a chronic care management program at your practice, but you're not quite sure where to begin? In this video, we'll discuss the exact steps you can take to set up and implement chronic care management in your own practice, so that you and your patients can start benefiting from the program right away. Hi, this is JP from ThoroughCare. We specialize in helping practices manage, bill, and streamline reimbursements for value-based care programs like chronic care management. More than 60% of Americans suffer from at least one chronic condition, with 40% of that population battling 2 or more chronic diseases. With those numbers in mind, it's obvious that CCM will be a valuable and much-needed resource for years to come. Additionally, healthcare providers are transitioning to value-based care and must find ways to promote clinical efficiency and improve health outcomes for patients. Care coordination programs like CCM can help ease the transition and ensure your patient's health goals are being met. Not only can a chronic care management program help with value-based metrics, it can also provide a source of additional revenue for your practice. Managing 250 patients in a CCM program can produce over $250,000 in annual reimbursements, depending on the CPT code reimbursement rate in your area. So what's the first step when setting up a program? First is to develop a plan for your office. This plan should detail the logistics and resources needed to run a successful CCM program and how you'll approach putting those resources into place. This includes managing enrollment, documenting consent, scheduling, and other related CCM activities. You'll need to prepare your staff to take on this new responsibility, which includes designating or hiring care managers. CMS requires that a care manager for a CCM program be a practitioner or one of the following certified resources: registered nurse, licensed practical nurse, certified medical assistant, and health coaches. Keep in mind, non-complex CCM does not require provider time. Your staff, who is most often represented by a care manager, can perform nearly all of the tasks required for CCM. The next step is to identify and recruit eligible patients. In order to be eligible for a chronic care management program, a patient must have 2 or more chronic conditions. Once you've identified a list of patients who meet the program's criteria, you'll want to determine the candidates who will benefit the most. A good method is to focus on a short list of specific diagnoses like diabetes, hypertension, depression, and COPD. It's ideal to target your Medicare Part B population who have 2 or more chronic conditions, since Medicare Part B covers 80% of the costs for that patient. You may want to check with your biller or other local insurance providers to see if CCM is covered in your area. When talking to patients about the program, you can highlight the many benefits, including cost savings, meaning less money spent on hospital bills, more efficient management of medications and symptoms, better access to the care team and other resources, convenience and improved quality of life, and improved coordinated care. Remember, according to CMS rules and regulations, once you have a patient on board for the program, you must get their written or verbal consent. Another important step to consider when starting a CCM program is making sure your staff fully understands the program and how it benefits your patients. The more prepared your staff is to answer important questions, the more likely a patient is to sign up for services. After enrolling a patient, the first and most important step is to create a patient-centered care plan. The care plan is a Medicare requirement and is based on a physical, psychological, and social assessment. You'll want to provide a copy of the care plan to the patient after you complete it and share with other providers as needed. Then, using the care plan as guidance, you, or more likely a care manager, will begin to manage the patient's conditions by completing phone calls and communicating regularly with the patient, coordinating with other clinicians, facilities, community resources, and caregivers, consistent updates of the care plan, ensuring timely receipt of all recommended preventative care services, and promoting medication reconciliation. As you can see, there are a number of important steps to consider when starting a chronic care management program. If you're interested in how ThoroughCare can help you set up and manage your own CCM program, please reach out using the link below. Please click like and subscribe to our channel to learn more about the many value-based care programs we offer. Thanks for watching.